Okay, hi, Dr. Brian K. Cameron. Thank you for joining us on this discussion about abortion. Before we get started asking you specific questions about abortion, which you are an expert on since your area of specialty is in ethics, I just want to get a few jargon items out of the way. So,
Okay.
first, when a sperm meets the egg, that's called conception. That's when we have an embryo. And until 9 weeks, it's an embryo. But then from 9 weeks until birth, you can call it a fetus. And then at birth, we call it a baby. So before the thing is born, it is not a baby. It would be either a fetus or prior to that, an embryo. But during this talk, let's just put fetus and embryo together. So after conception until birth, let's just use fetus for the unbirthed thing.
Yeah.
And now that we have those kinds of words out the way, I would like for you to tell us a little bit about abortion. What kinds of questions would somebody have at their first go at trying to understand whether abortion is moral or immoral, or whether abortion should be legal or illegal? What are the things someone should be thinking about, or the questions someone might be asking?
Well, there are a couple other things I should say that at least in the discussion we don't actually deliberate about, and that is, none of us seriously question whether the fetus is alive. We all accept that it is. None of us question that it's human. Of course, it has human DNA, and we all pretty much agree that it is an individual organism. So it would be a living human individual from the moment of conception. So all of those things are accepted, and I suppose the most obvious thing that I can say up front is that destroying something that is a living human individual is very different from discarding a piece of paper. It does require us to give thought to it and consider it independently of whether we think it has any rights. And of course, many people do believe that it has, in particular, something that would be a moral right, not a legal right, but a moral right to life. And so right away, what I think gets us worried about whether we ought to have or not have an abortion is, of course, whether this living human individual merits consideration, and indeed whether it has a right to life. And then on the other side of that, of course, you have the question of whether or not the woman, and it's pretty much the woman, because of the way that Roe v. has framed the debate, whether the woman has a right to decide to end or terminate the pregnancy. So the right to choice is not understood as a right to kill the fetus. Of course, it's understood as a right to terminate the pregnancy. It just so happens, of course, that doing so brings about the death of the fetus. I don't think anyone who seriously defends the pro-choice position thinks that it's a good thing that we bring about the death of a living human individual. I think they think of it as a necessary evil to protect women from male domination, and that they think that one way to do that is to ensure that women aren't subject to childbirth in a way that they have no control over, right? So again, if you look at the Roe v. decision, which in many ways has framed both the legal and the moral debate, that Roe v. decision in part was predicated on the idea that we want to ensure that women aren't subject to male domination, which is a very legitimate concern in our culture and indeed in many cultures.
So what you say at the outset makes me wonder, before we get into your theory on abortion, should we just be thinking about whether abortion is moral or immoral or should be legal or illegal in the context of an abortion with a specific cause of pregnancy? Like there's a lot of different ways someone might become pregnant,
Quite
like rape or
right.
consensual sex. Then there's a lot of different reasons why the woman might want to have an abortion. Like here's a few reasons: not
Sure.
wanting to be forced to have a child they didn't want in the first place is one reason. But then there's wanting to end the pregnancy because you don't want to have a genetic defect in the child, or monetary reasons or gender selection. So when you're going to tell us now what your theory of abortion is, should we have just one of those kinds of reasons in mind, or can you help us frame exactly the context that you'll be speaking about?
Well, actually, so the fact that we bring or introduce into the mix the various and different kinds of things you have in mind is in part what motivated me to reconceptualize the debate in the way that I have, because the current conflict, as it's understood, I suppose, on the street and in the national conversation, would have us think that it's really just a conflict between the rights of the fetus and the rights of the mother. And if that's true, then a lot of the questions that we ask in respect of the fetus, or in respect of, say, the father, or in respect of the mother's ability to care for the child, really don't get asked and really shouldn't have any relevance. And yet, they do appear to be relevant to our decision making. They do appear to be questions that we raise. And a good theory, a good normative theory, should be able to explain why it is that we ask those questions. So it was in part the fact that we raise questions that can't get answered very well by either of these two positions, which I'll kind of cash out a little more, that led me to then begin to think about, well, why is that so? And indeed, what can we do to sort of make better sense of this entire debate?
Can I
So,
repeat some of that back to you because that seems really important?
sure,
So I think what you're saying is a lot of people, when they think about abortion or when they're debating abortion, they think the problem here is, what side are you on? Are you on the side fighting for the fetus's right to live, or are you on the side of the would-be mother's right to abort? And you're
yeah,
saying it's not about that, because if it was about that, then it wouldn't make sense to say, well, is the fetus a person? Does the fetus have some kind of underlying right to live? Is it more than human? Is it a person? It wouldn't be making sense for us to say, well, why does she want to have an abortion? It wouldn't make
right,
sense for us to say, well, how did she end up pregnant? It wouldn't make sense for us to say, well, does the would-be father have a say in the matter? None of those questions make sense if it really was about who should be valued more here. So it's not about the difference between whose rights should we value higher. It's something else.
yeah. I mean, the question of whether the fetus is a person would come into play insofar as the right to life is not itself a legal right, because
Mm,
if it were, obviously, the people on that side wouldn't be fighting for
okay.
it to be a legal right. So it's a moral right, and the way to establish that it's a moral right is to argue that the fetus is a person.
Mm,
So that question would still come out, but the other questions really wouldn't.
okay.
Now, I would argue that, part of the reason that we ask those questions may be out of just, curiosity, who's the father, and so on. But if we explore why we ask those questions and we think, well, not everyone just is curious, but indeed they have more on their agenda, more on their plate. Is the mother in a position to care for the child? And sometimes we reduce that to her financial abilities or something like that. But actually, I think there's more to it. We recognize that taking on the responsibility of bearing a child and having a child and raising that child is an awesome responsibility, perhaps one of the most important responsibilities any of us can take on. And we have to ensure that we can discharge our responsibilities. So, if we're going to accept that responsibility, we have to know that we can discharge it. And I think that's what leads us to ask questions. Say we're the grandparents and we're thinking to ourselves, gee, do I have the ability to help out? Do I have the ability to be a good grandparent and to help out? Are we living in a community that has good childcare? We're asking those questions implicitly, in part because I think we're asking, can we discharge this responsibility? And if that's true, then neither the pro-choice nor the pro-life position would make much sense of that, right? And yet we are thinking about those things, right? We're asking ourselves, is the mother really in a position? Is she in a position to care for this child? It has something to do with money, but it has more to do with access to social goods, right? Is she in a position where she can access prenatal care? Can she access good daycare? Can she be a good parent to this child? And if we are asking about those kinds of things, that wouldn't make a lot of sense if it were her choice, right? Like she can choose Tide as opposed to Cheer. Or it wouldn't make any sense if the child has a right to life, because it has a right to life independently of whether the mother has the abilities to care for it, right? So none of those questions would make any real sense.
Got it.
Right? But they do, right? And we ask questions like that. And then we also ask questions like you pointed out a moment ago about, well, how did the child come to be? Was it a product of rape? What about the child's future? Does it have one of the genes for Tay-Sachs syndrome or something of that nature? And so, those are also considerations that come into play, which wouldn't make much sense if this were the whole of the debate.
Perfect. So let's get to the debate. You're framing it like this: pro-choice versus pro-life. Could you briefly say some things to let us understand what is on one side and not on the other? And then you can go ahead and tell us what side we should be on, according to you. But first, what exactly is that? What are the two ideas when it comes to abortion?
Well, so let me start with the sort of common sense view,
Okay.
and then let me move from that to what I think is likely where most people are at, and then finally try to move to something that I think is a better way to understand it.
Okay.
So the sort of standard view is that there are these two positions, pro-life and pro-choice, right? So let me start with pro-life. If we understood pro-life in a kind of absolute sense, it's basically saying that the fetus has a right to life, that that right to life is one that is violated by aborting it, because abortion, the implicit premise being that abortion brings about the death of the fetus, which it nearly always does, and in which case we are therefore violating its right to life, and that is wrong, and therefore we draw the conclusion abortion is wrong. So there is that side of the debate, right? Now, I'll be honest with you that I'm not entirely sure that the idea of a right to life, in the sense of continuing biological functioning, is something that makes an enormous amount of sense. I would understand it as something like a right not to be killed unjustly. But if that were the case, if it were a right not to be killed unjustly, then it would be a circular argument, because if we have an obligation not to kill someone unjustly, and you're saying that's the reason why we ought not to kill unjustly, you obviously have a circularity problem, right? The pro-choice position, to my mind, is even less, it makes even less sense. The pro-choice position is saying, well, that the woman, and it's pretty much just the woman has what's called a discretionary right to choose whether or not to bring the child to term. And
what do you mean by bring? Do you mean birth?
yes, that's right. And what makes this problematic is that word discretionary, because maybe at a legal level that could be permissible, but at a moral level, no right is one that isn't limited, right? Even free speech is limited. All rights are like the boundary of a property. The liberty is the space in between, right? But all rights are bounded. But here's the right which a person can exercise, specifically women, where they need have no reason. I mean, in other words, a woman can choose quite literally, according to Roe, by flipping a coin, right? I mean, she doesn't have to have any reason whatsoever, right?
So she could have abortion for any reason. It's her choice, no matter why she chose it.
Correct. She could throw darts at a dartboard, right? Now, at a legal level, right, the law doesn't necessarily have to line up with morality. So the law can say arbitrarily and just make a decision that the woman can choose in this fashion. But morally, that's deeply problematic, right? There would need to be compelling reasons because of the things that I said a moment ago. I mean, after all, we are killing something that is clearly a living human individual. Now, we can't think that killing a living human individual is a good thing. So we would have to have some justification for doing so, right? So at a moral level, the pro-choice position would require more development. Now, what's typically offered there is to say, well, women need this in order to protect their abilities to protect themselves from male domination, so that if they don't have power over their reproduction, then they are subject to male domination. I would concede that out of hand.
What does that mean, to concede that?
It means that I won't argue that in any way. I grant it, right? So I would agree with that reasoning. But then I would point out that well, you're skipping a step. And that is that there are, after all, contraceptives that are effective. And that if our argument was that women need to have a right to protect themselves from male domination and their ability and a right to control their reproduction, then they could achieve that by being given effective contraception and being educated as to how to make use of that. So if that were our objective, we could achieve that. And remember, laws aren't and shouldn't be understood as something that guarantee outcomes, right? We have laws against murder, yet murders still occur. The fact that murders occur doesn't mean there's a problem with the law against murder. It means there's a problem with us. So you would need another premise to explain why it is that women need to move from contraception to abortion. And I don't see that as being present in the pro-choice position, right?
Can I recap some of that before you get deeper?
Yeah, absolutely.
So here is the common sense way of understanding the debate on abortion. There's two main sides, often called pro-choice or pro-life. If you're pro-life, then you think the fetus has a right to live. So if the pregnant person has an abortion, they have violated the fetus's right to live.
That's
and
right.
that's what the pro-life argument is fundamentally. On the other side of the dilemma, as if there's specifically only two sides, would be
Right.
pro-choice. And the pro-choice side, as you're describing it, says that the woman is has innately the choice of whether or not to birth, to bring the child to term, as you said, and any reason will do. But one surface questionable feature of the pro-choice side is if it really comes down to wanting to preserve the woman's right to control her own body and reproductive organs, as many people say is the question at hand, then you don't need to be in favor of abortion. You could just be in favor of free contraceptives, because with contraception, you don't end up getting pregnant. You don't have to kill the growing fetus. And
And
so
education as to how to use them. Yeah.
excellent. Okay. So
Yeah.
now that we have this general two sides on the table, can we get into what exactly you think?
Not yet.
Okay. What
Yeah.
do we need before we can get there?
So what we need before we can get there is what I would say is the more reflective positions, and that is to recognize that there aren't just two sides, that indeed that there's a continuum,
Okay.
right? That actual people hold positions usually somewhere in the middle. For instance, many people who are pro-life will make exceptions in the case of rape or incest. Now, those exceptions, however, are extremely difficult to justify on the basis of the pro-life position, because usually they're going to say, well, the fetus is a person at the moment of conception. All persons have a right to life. Abortion brings about the death of the fetus. Therefore, abortion is wrong. And none of that changes because the fetus was the result of rape, or the fetus was the result of incest, or the fetus will be born with some terrible genetic defect, right? So making exceptions in that case also requires explanations, which aren't typically given. And and yet I think most people who are in the pro-choice or pro-life position make exceptions. So they seem to do, movement in one direction. And then, people on the pro-choice side might well hold what we could call what's called a weaker normative position. They might say, well, I personally cannot myself accept an abortion. I couldn't do it. But by the same token, I don't believe my reasons are sufficient to compel other people not to have an abortion. And so that's called a weak normative position. It's weak in the sense that it constrains you, but it isn't one that constrains everyone else, right? So people who hold that position would be holding a position individually more in line with pro-life, but collectively or socially more in line with pro-choice. And even there in the pro-choice camp, you have some, movement. I know there's reluctance there because of Roe v. Right? The worry is that if they give ground, then they might lose yet more legal footing. And so, there's less willingness publicly to admit to, movement. But in the scholarship, you will see many people on the pro-choice side saying, well, look, there does need to be a limitation on the kinds of reasons as to why women would seek an abortion. And
it can't just be any old reason.
it can't be just any old reason. That's right. You take someone like, say, Judith Jarvis Thompson, who has this sort of well-known, everyone reads it, who does anything with abortion, It's called a defense of abortion. Now, curiously, there's actually almost nothing in her article that shows why abortion should be permissible. It only shows why maybe some of the pro-choice arguments fail. But interestingly also is the fact that even if you granted her everything, she's only justifying at best abortion in three specific cases, namely when the woman is subject to rape, when the woman's life or the mother's life is threatened if she were to bring the child to term, or in a case where the mother has used all reasonable precautions to prevent a pregnancy, but because of some contraceptive failure, she gets pregnant anyway. Well, that doesn't cover the vast majority of abortions, right? And so that's a long way from justifying the pro-choice position as it's normally understood. It's a much more limited position. And of course, there's also the fact that even if I could show that abortion is wrong or right morally, that's very different from showing that it ought to be legal or illegal, right? That morality and law are not as immediate and direct as many people think, right? It's for instance morally wrong to lie, right? And I suppose we could have law that says you cannot lie. We have some limited laws there, like perjury and so forth. But for the most part, we don't have laws that require you not to lie. And I would argue that that's actually a good thing because we don't want people to act as if they're moral. We want people to be moral. We want them to be truthful and honest. And so not having law is actually a better way to secure that because people then do it because they judge it's the right thing to do, not because they're being forced to do it.
Okay, if I could bring us back, what you've said now is that it's not exactly pro-choice versus pro-life. There are some other theoretical options in between.
Yeah, there are many. Yeah, that's
So,
right.
so the version of a debate on abortion that you would get in mainstream is that there's these two options and you have to be on one of these sides or the other, and that it comes down to whether you think you should fight for the fetus or fight for the person who's pregnant.
That's
And
right.
now you're telling us there's a way more nuanced thing going on here. The pro-choice people make exceptions. The pro-life people make exceptions. There's a lot of room in the middle. It's not just these two sides.
That's right.
Okay.
That's right. And at this point, I can then begin to bring into play what I would argue is where I eventually came to.
Okay. So here we're going to hear the ideas on abortion of Dr. Brian K. Cameron, PhD in philosophy, who specializes in ethics and works a lot on abortion.
Yeah, so Sahara makes that sound so much better. So I began to think a lot about the kinds of questions that we ask when we hear that our daughter, our mother, our sister, our cousin, our friend is pregnant. And I realized that many of the questions that we ask wouldn't make much of any sense at all if these were the two, or even the nuanced positions, if these were the only positions on the table. So for instance, among the first questions that's going to get raised is,
Is it a boy or girl?
Well, no, we're going to ask who's the father.
Okay.
Right? I mean, that's almost always the first question, right? Who's the father? And, part of that could just be curiosity, right? But I suspect it isn't just that. We're probably asking that question, and we're probably also thinking about the father's family. We're also simultaneously probably thinking about ourselves, like to what extent can we be helpful? But we're asking questions about the father, and we're also thinking about the mother, because we're asking, well, is the father in a position to be a father to this child? After all, being a parent, we assume awesome responsibilities. And we need to know that these parties are in a position to satisfy those responsibilities, right? We have an obligation when we're anticipating accepting new responsibility to ensure that you and I are in a position to actually discharge them, right?
Satisfy those obligations to the child.
That's right. That's right. And so I suspect that at least at some level, many of us ask questions like, well, is the mother in the right place in her life? And yeah, we tend to talk about it in terms of money, but I actually think it's more in terms of access to social goods. Is it reasonable to think that she'll have access to good medical care? Do we think that the child will have access to a good education or good healthcare resources, good nutrition? Uh, and those are not unimportant questions. You know, what kind of community will the child be raised in, right? Will I, as a grandparent, or I, as a cousin, will I be in a position to aid? Is the community in a position where it will be able to protect the child? We at least at some level are thinking about those things, yet none of those things would make any sense if it were just a debate about the rights of the mother to choose, and she can choose for any reason at all, and the rights of the fetus to live, right? None of those would make any sense.
Mm.
And that got me thinking that maybe the problem, which is, I think, a consistent problem in ethics today, is that the question is framed incorrectly. It's framed as a debate about rights. And we frame, we frame most ethical and moral questions in terms of the rights of the parties involved. And I think that that's sometimes true, but it actually, in this case, is not particularly helpful because it gets in the way of us thinking about a more general category, which is obligation. See, rights are just a subset of obligation, right? In other words, they're part of obligation. So if I say, Sahar, you have a legal right to free speech, that's just an elliptical way of saying, or a roundabout way of saying, that I and every other citizen of the United States, its jurisdiction and territories, we all have an obligation not to interfere with your free speech, right? It's just a way of talking about obligations. If I have an obligation, or excuse me, if I have a right to, say, freedom of religious practice, that's just a roundabout way of saying you and every other person, and in particular the government, has an obligation not to interfere with my free exercise of my interest in conscience or religious identity and religious practice, right? So rights imply obligation. Obligations don't imply rights, right? So you can have obligations where that toward which you are obligated has no right. So let me give you some examples, right? There, of course, is the Sistine Chapel. There is the Great Wall of China. There are the pyramids of Giza. None of those things have any rights, let alone a right to life, right? So why don't we just bulldoze them down, right? Knock them down, put up a Walmart, put up some shopping centers, right? Build some parking lots. I mean, that Great Wall of China, think of all the opportunities, just knock that baby down, put some parking lots in, a Costco, a couple Walmarts, and so on and so forth. Why? Because they're things of value, right? And we have an obligation not to destroy things of value, right? And they're a testament. What makes them value? They're a testament to what human beings can create. Well, so it occurred to me, well, if we have an obligation toward things of value, then let's consider the fetus. There's no question that every culture takes seriously childbirth and childbearing and having children. So at least abstractly and in general, we think that children are valuable. But I think you can get even more specific and say, look, the moral community, and that's the community of persons who have rights, cannot be indifferent to the conditions of its own reproduction, right? That it has to be concerned with its own continuity, because the meaning of our own projects, the meaning and significance of the things that you and I do is typically located in the future, and in particular in the continuity of the moral community. I just imagine, Sahar, and all of you who are watching, if we knew for a fact that a meteor was going to strike the Earth in 2 days, most of the things that we think matter right now wouldn't, right? They'd stop having significance. Now, human friendships and relationships might still have meaning and significance. Art might still have significance, but a lot of the things that we think matter would cease to matter. Even things like researching for cancer, that would cease to matter, right? Cancer is going to end in 2 days, right? Vaccinating people from COVID, well, that doesn't matter anymore because we're all going to die in 2 days, right? So if you think about it, you realize the continuity of the moral community, the continuity not just of life, but of the moral community is what is the seat, or if you like, the location of so much of the meaning and significance of our own projects. Well, the fetus is already here. It's here and present, right? And it will be a bearer, if you like, of significance and meaning insofar as it is going to be potentially part of the moral community. And so the moral community can't be indifferent to it, which means it has to have value to the moral community, right? And I don't think anyone who, argues for the pro-choice position thinks that it's a good thing that we kill living human individuals. Like I said, I think at best, I think it's a necessary evil. If that's true, then they too must think that what they're destroying is something of value, right? So if you put those two premises together, right? In other words, that we have an obligation not to destroy things of value, and the fetus is a thing of value, then we could draw the conclusion that we ought not to destroy the fetus unless we have reasons for doing so that are at least commensurate or relatively equal with the value of that which we anticipate destroying.
Correct. That's a perfectly logical argument right there.
Yeah, it seems. I mean, I don't want to flatter myself and say that it is, but it sounds to me like it's a reasonable position.
Yes.
Now, it's not going to make anyone happy, right? It's probably going to irritate everyone because it doesn't give them the nice, hard line position. And, so there is that. But I think it lines up rather well with why we ask the questions we ask, because if the fetus is a thing of value, then of course it matters who the father is, who the grandparents are, what kind of community we're living in.
Right.
Because we need to protect this thing of value, right? We need to make sure that this thing of value has a chance to grow. And then of course the thing of this fetus that is the thing of value is also something that will later potentially create value. Right? So it has that additional feature to it, right? Now, I'm also adding, of course, that naturally, like anything of value, there could be reasons to destroy it. But those reasons would have to be pretty darn good, because what we anticipate destroying is something that is, very valuable, and also something that would be a creator of value.
So someone comes back to your argument and says that if a person does not want to bring the child or to bring the fetus to birth, creating the baby, then that's more valuable. Her desire not to do that, someone would argue, is more valuable than the value of the fetus. Another objection to your argument might be that, well, if we know that the fetus is growing with some genetic disorder, then there's little value. And once they're born, they're going to suck goods from society. So there's very little value there. And then by arguing that the fetus is less and less and less and less valuable, they're trying to accept your argument, but say, but we can still abort the fetus.
All right, well, let me try to deal with the first objection, which I would take to be a kind of subjectivist position, right? That the mother thinks that her decision is more valuable. So, to which I would respond, her preferences in and of themselves have no particular value until they are based on reasons, right? What possible reasons does she have for thinking that that she that not having this fetus, not having this thing of value, and destroying this thing of value, what reasons does she have for doing it, right? It can't just be that she thinks she's more important, right?
So it can't just be anything.
It can't just be anything, right?
But if it's something that she argues, like she'll die,
well, that's a good reason.
Then you're allowed to say, okay, Dr. Cameron, you're right. The fetus has this value, but then the woman's value is much greater, and so she can abort under that circumstance.
Well, I wouldn't be so quick to say it's much greater. I would be saying, well, the woman can't be thought to have an obligation to die, and she is already present in the moral community. She has value, and moreover, it's very likely she has other obligations, and those obligations might be to other children or to other members of society. Those obligations also have value, right? The fetus doesn't yet have any of those kinds of entanglements. So, we might well say, yes, that's a good reason, right?
Because but your argument still allows for abortion in some cases. Your argument isn't never have an abortion ever.
Correct.
It's that there better be a reason that makes the value of the fetus less than some other value.
Well, I wouldn't say less than. I'm trying to avoid that language because I don't want it to sound like a utilitarian position, which it isn't, right? What I want to suggest is that when you and I make decisions of this nature, we really are thinking about value. And we're thinking about the various ways to balance out value. In the case of the mother's life, we can't have it both ways, right? I mean, of course, the mother can choose, right? She is at liberty to choose to bring the child to term, knowing that she may well die. We're not denying that. But then again, we value the mother's autonomy, right? So it's not a question of what matters, what values outweigh what other values, so much as saying we need to take values seriously.
Okay.
And we do take values seriously, but the debate as it stands doesn't.
Excellent.
Right? Yeah.
So
then I would go ahead.
The second part was if we found out that there was a question, should we abort because of some genetic defect? Does that affect your argument? Because your argument is fetuses have value. That's what makes sense of the questions we ask and the preparation that goes into a pregnancy. It has value. But if someone says, but what about the case where the fetus has a genetic defect and they're just going to take the social goods and potentially not add what we would normally expect a fetus or a child to add to the value of the moral community? How do you respond to something like that?
Well, it would depend crucially on the specific genetic defect, right? So a genetic defect like Tay-Sachs, for instance, in which the child is basically condemned to die, right? And it's going to suffer. There is little or no value in pointless suffering, right? So in that case, right, we could say there's no value in a life of continued suffering and misery for it, and that, you know, as much as we might want to bring a child, that has value, we don't also want to do it in such a way that it occasions horrific and terrible suffering. So for those genetic disorders which are effectively deadly, right? And by that I mean not just at some point, but relatively early on.
Mm.
I would say, there we probably would favor or could reasonably favor, ending the pregnancy.
So
On the
the
other hand,
fetus is born and then lives a short while in pain. Is that how that works? And you're saying in that case, the suffering is so great that maybe it makes sense to end the pregnancy before the fetus is born?
it's, yeah, so it would be a matter of justice, right? So the child isn't owed that suffering.
Mm.
It didn't ask for that suffering, and it didn't ask to come into being. And if this is the only being it will ever experience, right, then, it might not be unreasonable to say, yeah, we'll end the pregnancy. Um, on the other hand, I don't take into consideration social losses, right? So it's not as if I would care if it's a drain on social resources. I mean, the United States has plenty of resources. So it's not really a question of social good, because after all, there's another really important good here on the table, and that is love, right? A child that's born, even in cases where it has very severe cognitive or physical impairment, as you and I would see it, might still be something that could be exceedingly important in the lives of its immediate family, and indeed bring that family together, indeed be a source of love, hope, inspiration. And there's no particular reason to assume that that child couldn't itself have some valuable life, right? But even if it didn't, even if there wasn't a subjectivity there where it could experience its own life, it might well be that a good is added, right, in the value of the lives of those who learn that they in fact can be caregivers, right? I mean, that's one of the things about being a parent is that or for that matter, being, say, a dog owner. I'm a dog owner, right? And the kind of dog I have is a Shih Tzu. And I mean, Shih Tzus aren't exactly great hunters. They can't really care for themselves. But one of the things that I like about it is that, as a male in particular, I get to see a side of myself that I don't see very often, and that is the side in which I am caring and protective and giving to something that needs that care, and that I value, right? So it can be the case that a child, even with severe genetic disorders, could give great good, but that would depend on the people involved, right? So I leave that open. And one of the advantages, I think, of my position is it does not in any way lead to a legal conclusion, right? In fact, there's a significant jump between my position and the law, which to my mind is quite right? That what ought to be the good or the right here is very different from what ought to be legal or illegal. And so there would still need to be yet further argumentation to say what would make it legal or illegal, right? Because these are distinct questions,
Right.
right? And the justifications for either are are different, right? So the advantage of my position is I'm saying, well, look, the reasons we have for aborting the fetus, or the reasons we have for bringing it about, these reasons aren't being taken seriously right now, but my position takes them seriously and asks us to reflect on those reasons, right? In ways that I think take seriously the responsibilities we have to the fetus and the responsibilities we have to ourselves, right? And I'm not worried about maximizing social good, right? So I'll just be direct and blunt about that.
Excellent. Well, if there's anything else you'd like to tell us about abortion, why don't you have the closing remarks here?
Okay, so one of the other things that my position can do is that it can be linked up with a virtue ethical position. So,
Explain that a little bit first, please.
well, you mean virtue ethics?
Yeah.
Okay, so a virtue ethics is an ethical position about the good that focuses attention not on action, but on the kinds of persons that we are.
Mm.
And so, not that those aren't unrelated, because they are related, but instead of taking action as primary, it takes our character, our moral character as primary.
Okay.
And so, a virtue is a trait of character that reveals a stable inclination to do or not do something. So, if I have the virtue of, say, being honest, then you're not just saying, well, he was honest then, he was honest then, and he was honest then, but you're saying, no, he's the kind of person that I can anticipate takes honesty seriously. It matters to him, and that he will seek out he will seek to be honest in his interactions with other people. So honesty is a trait of character. And so one of the advantages of my position is it can be paired with a virtue ethics in which we think about the kinds of virtues that are relevant to giving good care to a child. Because again, the pro-choice position and the pro-life position seem to be really concerned about getting the fetus either outside of the womb or inside the womb. But they don't seem to care much about what happens afterward, right? But life doesn't end at birth, right? And so we need to be thinking about, well, what is it to have a community that is one that is good for children? What is it to have a good community? What is it for us to be good parents? What is it for us to be good neighbors to those who have children? What is it for us to create a good healthcare system for children, a good educational system for children? What about war, right? What about poverty, right? What about any number of other issues that impact race, right? Ethnicity, gender. You brought gender up, for instance. I mean, that's a very live option, right? Religion, all of these things come into play, and they should come into play. And a virtue ethical position would take seriously the kind of persons we are, but also the kind of community we live in, right? Because you can always use a virtue ethical position to say, well, look, any set of practices or institutions that leads to defective people is likely a defective institution or a practice. And so if we have a kind of parenting in which we put our children in front of a flickering box or hand them one of these and think, well, that's what it is to be a good parent, then we clearly haven't thought very much about what it is to be a good parent. And just getting the child out of the womb isn't enough, right?
Excellent. That's a good point. So your stance on abortion focuses on the value of a fetus and the value of human life more generally. So
Yeah,
you're not thinking that we could talk about abortion and just focus on whether we should stop a pregnancy or force it to happen or allow someone to stop it. Instead, you're taking a very zoomed out perspective where you're asking about abortion in light of how the entire life will go and how the entire community would be affected.
That's right, including the woman, right? I mean, I want to be clear. I take seriously that women are placed at a serious disadvantage in our culture. And that disadvantage is almost, I mean, if you look at the economics, you can see, especially if you compare, say, the United States to other countries that, you know, uh, require men, for instance, to also take leave when they have children, like Iceland or Norway or so on, you'll see that the pay differential and the wealth differential between men and women, uh, sort of equalizes out. I take seriously women's lives too, right? I think, of course, one of the reasons why the pro-choice position has traction is because women do face extent and serious discrimination and do face institutions which are male, right, in orientation. And so I want to protect them too, right? So I want to take seriously the value of everyone's interests and not just these two extreme positions.
Excellent. Thank you so much, Dr. Brian K. Cameron.
Well, thank you, Sahar, and I really appreciate taking this time with you, and it's been a pleasure.